Hey future doctors, today we are going to see about hypertrophy. So it is an increase in the size of a parenchymal cells or resulting in the enlargement of the organ or tissue without any change in the number of cells. So basically in the hypertrophy, the size of the cells it increases and it results in the enlargement of the organ. So there are some causes which causes the hypertrophy. It can be physiological as well as pathological. So in either cases it is caused by increased functional demand or by hormonal stimulation. Then hypertrophy without accompanying hyperplasia, it affects mainly muscles, and in non-dividing cells too only hypertrophy occurs. So first is physiological hypertrophy. So enlarged size of uterus in the pregnancy, it can be an example of physiological hypertrophy, as well as it can be a case of a hyperplasia. So in cardiovascular diseases, there can be a hypertrophy of cardiac muscles. Then there are few conditions which produce the left ventricular hypertrophy. For example, hypertension, then aortic wall disease if there is stenosis or insufficiency, as well as mitral insufficiency, it may cause hypertrophy. So this is the diagram of a cardiac hypertrophy. In this, the weight of the heart is increased. The chambers are also open at the apex, which shows the concentric thickening of the left ventricular wall and with obliterated lumen. Here you can see that this is a lumen and it is without dilation. And here you can see that the left ventricular wall is thickened and the chambers are opened. The next example is hypertrophy of smooth muscle. It occurs in the cardiac achalasia, in the esophagus, then pyloric stenosis in stomach, intestinal structures, then in muscular arteries in the hypertension. So in these cases there can be hypertrophy of smooth muscles. Then hypertrophy of skeletal muscle. It may occur in the athletes as well as manual laborers. Next is compensatory hypertrophy. It may occur in the organ where the contralateral organ is removed. Means if there is nephrectomy on the one side in the young patient, then there is a compensatory hypertrophy as well as hyperplasia on the nephron of other kidney. Then there are some morphological features. So here affected organ is enlarged as well as heavy, as you can see in this figure. Here example are hypertrophied heart of a patient with the systemic hypertension. It may weigh 700 to 800 gram as compared to average normal adult, which is about 350 grams. So this much is the difference between the normal as well as hypertrophied heart. Can also lead to increased synthesis of DNA as well as RNA. So as this is increased, then the protein synthesis will also increased, and as well as organelles it will also increase, such as mitochondria, ER, myofibril get increased. So this was all about hypertrophy.